So as a doctor, the most common question I always get is right here. One of the common questions, Doc, why do I hurt? We all know we're in pain, and by the time you actually get to my office, you are in pain. Okay, that's why you come to visit me, because you hurt. And that's a multifactorial answer. There's not one reason why we're in pain, because systematically we're in pain every single moment of our lives right now. If you sit, for example, if you're sitting in your chair long enough, your butt hurts, correct? Yeah, so you have the pain fibers firing all the time. It's just that when it hits threshold is then actually when you start to do something about it. However, why do I hurt? It's multifactorial, right here. Most back disorders are the result of stressful living. And of course, if you live in the 21st century, we don't have any stressful living, correct? All right, stressful living and work habits. What do we do now at this day and age in the 21st century? We're at our computers most of our day. And sit at a desk, how do you sit? You don't sit in the standardized textbook position, right? No, we all sit slunched over. So yes, now we go home. So we have a long commute. Also too, poor body mechanics. We don't sit, every time we pick something up, we do not always bend at our waist. Correct? Loss of flexibility. Yes, as we get older, we lose the flexibility. Males more than females. Also too, decline of overall fitness, lack of exercise, and of course, poor posture. These are, again, it's a multifactorial question of why are we in pain. However, that's not the end of the world why we're in pain. Why? It's an epidemic. Okay? It's an epidemic. That means that globally there's a problem. Not just one or two people, it's globally. So basically, too much time and money is spent on treating low back pain rather than preventing it from happening. What happens when you go to your primary doctor? You get a prescription. Typical stack is anti-inflammatory, anti-pain, and then what? Antispasmodic. What does that mean? That means that we treat the symptoms instead of learning to prevent the situation from happening in the first place. Also, only about 3 cents of every dollar spent on the care of low back pain is spent on prevention. I'd rather save money than waste money.